So COVID-19 is not gone. Let's not fool ourselves at all just because the state of disaster has been lifted. It is on the decline, but still very much with us. It was just a few days later we then heard about monkeypox. We were told not to panic, but now there's another global health emergency. Monkeypox has the world holding their breath. Currently 18,000 cases in 75 countries, with the US being the epicenter with over 3,000. So let's find out where we are about understanding this disease. I'm joined by virologist Professor Marietjie Venter joining us this morning on the show. Prof, always good to have you on. So we were told not to panic in the beginning. The numbers aren't massive, of course, but how concerned should we be about this? What's the World Health Organization saying? Good morning.
Good morning, and good morning to your listeners. Yes, monkeypox has been around for many years, really. It's a disease that was first identified in monkeys that was exported for research to Copenhagen, and these monkeys actually presented with similar to smallpox signs, and so it was called monkeypox. But the disease really comes from Central Africa, so in the Congo area as well as West Africa, and in these areas it's actually transmitted by some rodents and by squirrels. So it's not really a monkey-related disease, but it can spill over into monkeys. So that's where the name comes from. Yeah. And over the years, there's been many cases in these areas, but really limited to to transmission from animals to humans, and then limited human-to-human transmission. And so what's really different now during this outbreak is that there's been transmissions from West Africa to first in the UK, and this was mainly in men that have sex with men. And so it has spread in this community, especially amongst people that have multiple sexual partners. And so there's large numbers of cases in Europe, and it spread to the US and across the world, and as you said, in 75 countries already. So the virus is really transmitted by very close, intimate contact. It's not as transmissible as COVID-19, so it's not something to panic about, but it's also much milder. So in general, the case fatality rate was recorded over the years to be about between 3 and 6%. But in the current outbreak, in the over 18,000 cases, there's been 3 recorded deaths, or 5 recorded deaths, sorry, and they were actually in the African countries. So it's not really part of the current outbreak where these cases were recorded.
Yeah, and I see as well that this multi-country monkeypox outbreak has now been declared a global public health emergency of international concern. So what does that do? What sort of alert status does that put experts like you on here in South Africa? What do you do? What do you scale up?
Yeah. Well, the reason for the WHO to declare these emergencies is really so that they can take action internationally to help countries to control it. So it's very important to take note of the potential of this virus to spread widely through close skin contact with infected people. And they are able now also to activate a spread of vaccines or a distribution of vaccines to different countries. So in the past, monkeypox is closely related to smallpox. And so people that still had the smallpox vaccine, so it's people over 40 and over 50 really, in South Africa still had the vaccine, are probably protected. So we know that the smallpox vaccine protects about 85% to monkeypox, but of course young people had not received the vaccine yet, and the vaccine is currently not widely available. So by declaring this an international emergency, it activates the vaccine producers to also then ensure that the vaccines can become available. It also ensures that labs are able to test for the virus, and then to raise awareness amongst high-risk people that to try to avoid infection and try to stop the spread of the virus.
Professor, I'm going to say thank you very much indeed for the latest on this. It's very important we keep talking about monkeypox, just to keep an eye on it. A global pandemic is what it's been declared at the moment. Let me just make sure I've got the exact wording here. It's a public health emergency. It's been declared. It's an international concern. Prof, I appreciate you joining us and speaking to us this morning. So increase in numbers, over 18,000 globally, but no need to panic for the moment is what we're told by virologist Professor Marietjie Venter. We'll keep a very close eye on that, of course. We will here on eNCA.